Nurses have been on the front lines of the pandemic since the very beginning.
We're working in a state of very high stress. The psychological tension has gone through the roof.
Many paid for their service with their lives. The World Health Organization estimates that 115,000 nurses worldwide have died in connection with a coronavirus infection. Is the nurses' hard work being given the appreciation it deserves? Many are still waiting for the financial applause. And they are demanding better working conditions. How can it be that the heroes of the pandemic are still struggling for recognition? Welcome to your COVID-19 special. I'm Chris Kober in Berlin. Despite their heroic efforts, healthcare workers around the world are now learning that they are subject to a rather unforgiving system. Take Spain, where more than 80 doctors and nurses themselves fell victim to the coronavirus. The government promised to improve working conditions, but instead, with infection rates declining, thousands of healthcare workers have already been laid off or soon will be. DW's Jan-Philipp Scholz reports from Valencia in eastern Spain.
Laura Almodever has been told her services are no longer required here on the COVID-19 ward. But she still has her hands full. Many of her colleagues at the Valencia clinic are gone. In the surrounding region alone, hundreds of nurses were let go overnight. Many of her co-workers were informed that they'd been laid off in a text message.
I think it's shocking to find out your employment has been terminated like this. It shows zero respect for the people who gave everything during the pandemic. At the time, they were urgently needed for the system to keep running. And now it seems as if they are just disposable staff.
A standing ovation for health workers, the heroes of the pandemic. When Spain was particularly hard hit by coronavirus in March 2020, thousands of nurses were hired at short notice. Many fell ill, some even died of the virus. But now that COVID-19 numbers are falling across the country, these nurses are no longer needed.
More than 1,000 nurses have been laid off here in the Valencia region in the past few weeks alone. For thousands more, their professional future is uncertain. Within a few months, they seem to have gone from heroes of the pandemic to redundant personnel.
The layoffs have led to furious protests here. Most of those who have been sacked are afraid to speak to us on camera. Only one person is willing to speak anonymously by telephone. He tells us that he and his colleagues feel abandoned. When the virus happened, we were short of everything we needed to fight it. We were brutally overloaded with work. We couldn't even take care of our own health, and that had extreme effects on our private and family life. Now it all seems like exploitation to me. In recent years, Spain has made massive cuts to its public health system. More than a third of medical staff only have short-term contracts, and many clinics have been privatized. During the pandemic, the government promised improvements, but instead the situation has worsened. And yet those in charge haven't changed their tune.
We are currently making great efforts to create more permanent positions and to ensure that fewer people have to work in unsafe conditions. We hope that the situation will improve in 2022.
For nurse Laura Almodever and her fired colleagues, there could be some good news, at least for now. Many of them will be reinstated over the summer to fill in for others who've gone on vacation.
Let's get more on this with Howard Catton. He's the CEO of the International Council of Nurses, ICN, and he joins me from Geneva in Switzerland. Welcome back to our show, Howard. Zero respect for the people who gave everything during the pandemic, as one nurse called the sacking of healthcare workers in the report we've just seen. Do you agree?
I think that this is a shameful way to treat nurses and healthcare workers. These are the people who have put themselves ahead of everybody else, who've gone to work knowing that there's a greater risk that they might become infected, haven't had the personal protective equipment that they need, have often separated themselves from their families so as not to present a risk to them, who have stepped into the shoes of relatives. They are not disposable. They are indispensable. They are the heart of our healthcare systems. And we're seeing around the world nurses who are angry at this lack of recognition and respect, and an increase in strikes in Europe, in Africa, and in the Pacific region as well.
On that note, healthcare workers do have a huge leverage, particularly now in the pandemic. If protests grew, if more nurses went on strike, that would create enormous pressure for their cause, wouldn't it?
We went into this pandemic 6 million nurses short globally. We've got aging nursing workforce in many countries. We've got nurses who have left because of burnout, because of anxiety. We don't know the impact of long COVID. The last thing we can afford to do is to lose our nurses. Our hospitals, our clinics, without staff, without nurses, they're just empty buildings. It's the people that matter, and we should be investing in them and protecting them.
Now, the pandemic is at a different stage in different parts of the world. Do you see situations improving for healthcare workers in areas with high infection rates because of the lessons learned earlier elsewhere?
We are seeing many places where nurses are taking on increasing leadership positions. They're at the forefront of the public health messages, organising systems of care as well, and the situation is improving. But we are also seeing areas where the virus is resurgent, and there is a huge issue at the moment with the inequity of access to vaccines for nurses and healthcare workers. There are nurses and health workers in some parts of the world still waiting to be vaccinated, whilst younger people are being jabbed in other countries. We all know we're not going to win this race against the virus on our own as nations. It is a global race, and we need to see much more sharing and solidarity and cooperation around the world.
In an ICN report published earlier this year, it says studies across regions suggest that the pandemic has exacerbated the stress and anxiety felt by nurses and other healthcare workers. What do these people suffer from in particular?
We have seen huge physical and psychological impacts on nursing and healthcare staff. Physical exhaustion, insomnia, burnout and stress, but also the emotional burden of being away from your family, looking after people, more people who are seriously ill, who are fearful, more people who are dying. On top of that, we have also seen examples of discrimination and violence against nurses. People who may be ignorant or fearful, but, nurses who've not been able to renew their tenancy because their landlord is worried that they're spreading the virus. Nurses having difficulty accessing childcare for their children as well. And nurses being subject to the COVID deniers who are saying this whole thing is a hoax. We've called this a mass traumatization of the nursing workforce. And that's why we need to be focusing on the recovery of our nurses and our healthcare workforce right now.
Howard Catton of the International Council of Nurses, thank you for your thoughts.
Thank you.
Getting the right jab has, for many people, been the most promising way to protect themselves against a severe coronavirus infection. Vaccines have been subject of many of your questions. Here's one, and our science correspondent, Derek Williams.
Every country has a different strategy to prioritize vaccines. What does the science say about how to best allocate them?
We're still in the middle of the biggest vaccine drive in history. So evaluating the moving data on this topic is really a pretty tall order. To be honest, I don't even know if looking back in the years to come, if we'll be able to say anything with certainty. about whether countries might have prioritized the right groups for vaccine allocation in the right order. That's because demographics are so different in different countries that making blanket statements about what works best can, I think, provide, at best, just rough guidelines. There are just too many variables. The big problem is that allocating vaccines means making choices that are at odds with each other. The most obvious of those choices is whether to cut down on the death and suffering caused by the disease as quickly as possible by vaccinating the most vulnerable first, or to instead try to vaccinate those who are most exposed. So those who will catch the disease most often and hence really drive further transmission. Countries with aging populations, like many here in Europe, went for the first option. They decided to prioritize the elderly, the group that's most at risk if they contract COVID-19. And that choice seems to be working at preventing death and suffering. A British healthcare authority, for instance, has estimated that the campaign there, which focused on getting elderly the shots first, that it saved over 30,000 hospitalizations and 10,000 lives so far. But that's also left a large segment of the population, younger people, unvaccinated for many months. And of course, as the group that's most regularly exposed, they're now fueling a new outbreak there. So what's the best prioritization strategy? I don't really know if you can put it that way. I'd say that there are just strategies with different outcomes.